Hello, everyone. Welcome to Indiaspora Community Conversations number 9, a monthly program with Sri's global show around COVID-19 on scroll.in. Today, we have a very important topic, COVID-19 relief in India, from giving to on-the-ground impact. We have so many fantastic speakers joining us today. You can see the lineup on the screen. And we are going to have separate sessions, mini sessions with a variety of folks who will help us understand what's happening on the ground. We are very proud to have this connection with Indiaspora and these community conversations. Thank you so much for being here, everyone. Hi, folks. I'm Sri Srinivasan. Thank you for being here. We're live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. We'd love it if you would, on those platforms, hit share so your friends and family can join us live or later. They can see it as soon as the show's over. It will replay on all of those platforms. It is very special opportunity for us to connect with Indiaspora and its amazing network. And right now, I'd like to bring the Executive Director of Indiaspora on the screen here with me, Sanjeev Joshipura. Hi, Sanjeev.
Hey, Sri, how are you doing?
I'm doing very well. How are you? And congrats on all the incredible work Indiaspora has been doing at this very difficult time in India.
Well, thank you, Sri. You're right. It is such a hard time, such a difficult time in India, and I hope that the conversation that we have today sheds some light on not just the situation, but what can be done about the situation and how we can help.
Yeah, and we want people to tell us where they're watching from. They can tell us in the comments, and also any questions you might have about what's happening on the ground. And you've set up a very good panel for us, so tell us what we're going to be hearing today.
Yeah, so let me do this, Sri, if I could. Let me just quickly introduce Indiaspora for those of us on the show here today or watching that may not know. First of all, let me just start by saying that it's such a pleasure to partner with you, Sri, on this monthly basis. You run a fantastic show, and it's just a delight to do this with you on a regular basis. So Indiaspora is a non-profit organization. We were founded in 2012 by the investor and entrepreneur M.R. Rangaswamy. And we are a collection of Indian diaspora leaders across the world from different backgrounds and different professions. We focus essentially on 3 pillars. One is we foster non-partisan political engagement and civic engagement. The second is we catalyze entrepreneurship and innovation. And the third, which is the most relevant for today's show, is we are a platform for philanthropy and social impact, both towards India and in the local communities and areas of residence where the diaspora lives. Our overall thematic mission is to position the global Indian diaspora as a force for good. And what I really want to talk about today is the work that Indiaspora and several other organizations whom you'll meet on the show today have been doing in regards to helping India at this very dire point in time. It's the worst challenge, I would say, that India has faced since partition. And it's very heartening for me personally as an Indiaspora employee to see the diaspora stepping up. You'll hear more about that over the course of this program, but let me just quickly introduce 2 initiatives. One is Indiaspora is running a program, our annual giving program called Chalo Give. And for those of you that might not speak Hindi, Chalo in Hindi translates to let's go or let's do. So the rough English equivalent is let's give. And it's an annual giving program that we started online 2 years ago. And in 2020 and 21, we focused the program on COVID. In 2020, it was COVID in India and in the United States. In 2021, luckily, things are looking better here in the United States, but India, as we all know, is facing such a dire time, and so we are focusing it on India. And the other thing that I just want to mention briefly is over this past weekend, Indiaspora co-hosted a program, an online program, with Jay and Radhi Shetty, who are famous YouTube personalities, and Jay Shetty is also an author, a former monk who is now a media personality. And it was a wonderful program, which raised a lot of money towards the COVID situation in India, towards fighting the COVID situation. But without further ado, let me introduce my colleague in Seattle, Washington. Ashish Shah is our Senior Director of Philanthropy and Community Engagement, and he can tell you a little bit more before we start with our panel.
Thanks, Sanjeev. Shri, delighted to be on the show. So as Sanjeev indicated, Chalo Give is an Indiaspora initiative. It is Indiaspora's online giving campaign. Just some background, Chalo Give was set up for two things essentially: making giving easy and creating a platform for the Indian diaspora to come together, give, and catalyze social change. And if there was ever a time for the community to come together to give to the extent possible, it is now. There is hardly anyone who is not touched by this second deadly wave in India. And so, in response to this, as Sanjeev indicated, we launched our Chalo Give campaign last week. We are focused on three areas. Number one, setting up COVID care centers and makeshift hospitals to isolate infected patients and essentially stop the spread. Number two, provide food relief and livelihood assistance to migrant workers and their impacted and other impacted communities. And number three, provide direct cash support to families who have lost a primary earning member. So far it's been a great start of the campaign. We've raised over $1.1 million in less than a week, but we all know that we need to keep going. As Sanjeev mentioned, we were the $1 million matching partner for the weekend fundraiser hosted by Jay and Radhi Shetty. That got a lot of social media attention, which is great because that just encouraged more donors to give and helped us amplify the impact of our giving. All funds that are raised will go to 4 incredible organizations, some of whom you will hear from later in the show. So, if you're looking to give, do it now. Time is of the essence and every dollar counts. And please help spread the word.
Thank you very much, Ashish, for sharing that with us. This number is fantastic. Sanjeev, how did this come about? You mentioned the efforts of Jay Shetty and others, but if there's something more you'd like to say about this.
Yeah, Shri, it's just a tremendous outpouring of generosity in our communities that we've seen again this year. In fact, even more so than last year, commensurate with the scale of the crisis, really. I mean, it's a lot of tremendous work that's done. The donors obviously are very generous in their giving, but I think the key thing to highlight as well is the tremendous work that's done on the ground where the funds are deployed, and that encourages donors to give even more. And the organizations that we've selected and others that you'll see on the show today are really doing yeoman's.
All right, we'll just bring on our next speakers in just a second, but we just want to say hello to folks. Hetal Gandhi saying hello from Jacksonville in Florida, looking for ways to help India. So Ashish has a simple answer on how you can help.
Yep, please go to the Chalo Give website and give to the extent possible. And just to answer your previous question, Shri, we've thought that there's going to be donor fatigue and, how is this campaign going to go in 2021? But the situation in India is so desperate that people have responded incredibly. We're just blown away by the response we've got. So
that's I'm so pleased to hear about everyone helping. Ellen saying hello from New York City. Preeti's watching in Delhi. Anil Kumar Roy is watching in Bangalore, and Jeanette is watching in Seattle. She says she's very concerned about the situation in India. So let's go on to our next set of speakers, and Sanjeev set it up for us. We'll show everyone who is coming on, and you'll tell us about that.
Absolutely. So I'd like to introduce a panel of 3 great friends and 3 stalwart professionals in the philanthropic space. And they are Nagma Mulla, the CEO of Idle Give Foundation, Nishant Pandey, the CEO of American India Foundation, or AIF, and Roma, Bose, who is the senior advisor with Wish Foundation here in America. So if they can join us here on the screen, there they are. That's great. Welcome, Nishant, Roma, Nagma. Great to see all of you.
Thank you for having me here.
And a very good morning, early morning to you, Nagma, in India.
Thank you. Yeah, it's good to begin the day with you.
Great. And Roma is joining us from Boise, Idaho. And Nishant is, as always, in New York City.
Fantastic. Hi, Sanjeev. Great.
So, what I'd like to do is I'd like to dive in right away into the topic at hand. Let me start by asking the first question to Roma. We'll kind of do a round robin of all the three panelists, and then we'll launch into follow-ups as well. But let me start with Roma. Roma, the Wish Foundation is doing tremendous work in terms of setting up COVID care centers in India, in several selected states where you have great relationships. I've had the privilege and good fortune of visiting one of your Mohalla clinics in New Delhi a few years ago, and since then you've only grown from strength to strength. So tell us a little bit more about the Wish Foundation and really specifically what you're doing right now in the second wave of COVID in India.
Thank you so much. First of all, let me just say I appreciate inviting us to this panel, and of course, never has been the time more important or giving more important as now. I first of all want to acknowledge and thank all my field workers. There are 500 plus staff members in the field. They're working day and night, despite some of them having caught the disease, but they are not giving up. So just to give a little background on the organization, 30 seconds. So Wish Foundation was set up in 2014 with the generous support of Mr. Sunil Wadhwani and his family. And we have been working since then in partnership with several state governments. So our business model calls for partnering with state governments, designing technology and digital health solutions, innovative solutions to fill the gaps in primary healthcare, and then handing over the models, successful models, back to the government and enforce and ensure that they are working effectively. So the COVID-19 surge and the pandemic is new, but the need for strengthening the primary healthcare sector has been there for years and years, which is why with the vision of our founding donor, Mr. Wadhwani, this was set up because we knew that someday this could happen. Having said that, let me just move on to tell you exactly what we are doing. So yes, we are setting up several COVID care centers. We work in 5 states, which are Assam, Delhi, Rajasthan, Madhya Pradesh, Uttar Pradesh. So since last year, 2019, when this COVID came upon India in early 2020, that our staff swung into action. We were the first ones to partner with the government in helping them set up their guidelines for isolation, for surveillance, for testing suspected cases, and many other, and social mobilization and things of that nature. So we have been working in addressing COVID care issues since last year. Now, I must emphasize that all of this has been going on in addition to the existing primary healthcare issues. So so the burden on the staff and of course the public and the public healthcare system is doubled since last year. Now, what have we been doing, if you would like to know? Thanks to all our donors, I want to thank Indiaspora and all the supporters of Indiaspora and the donors who have come forward in helping us set up these COVID care centers. Now, our goal is to have at least 2,000 beds in place. Right now, I'll give you a little snapshot of where we are with regards to doing that. In addition to the beds, before I move to the beds, I must tell you that since last year, we have also supported the government, these 5 different state governments with PPE equipments, thanks to some of our donors in the US, in New York and other places, as well as local donors within India, PPE equipments, as well as other medical equipment required. So right now, let me just start by saying that we have been supplying medical equipment and amenities, including oxygen concentrators and cylinders, in addition to human resource to manage all of this work within the government's healthcare system. There are 3 or 4 models of COVID care centers that we are running right now. One is where we supply medical equipment and amenities to the government hospitals, as well as primary healthcare centers. The second model is where we do the overall operation and management of these COVID care centers. The third model is where we are setting up COVID care centers within buildings like schools and hotels and community centers across various geographies, and I will mention that in a bit. We're also setting up COVID care centers, step-down models where patients are not as affected, but they need some hand-holding and some support, and especially in terms of isolation. As you know, people live in small dwellings and in multi-family units, so they really need to have space and room to be isolated. So that's our fourth model. Now, I'm happy to share that as of this morning or yesterday, India's morning, we were able to launch our first 10-bedded COVID care center in Madhya Pradesh, in Jabalpur, and the second one is to be launched in a couple of days in Bhopal. Needless to say that we are working in Delhi as well, which is the epicenter. So in Delhi, we've provided, like I said, oxygen cylinders and concentrators and oximeters and all of those things, in addition to mental health and whatnot. So if people would like to know the geographies, I'd like to say that we are partnering with Holy Family Hospital, where we have provided the medical equipment that I just mentioned and beyond. We are also partnering with Max in Saket. We are setting up a unit in Rohini. And of course, we are also helping the government in their vaccination program. And I'll take just another minute to tell you about what's happening in 4 other states. Gurgaon, we just got assigned Badshahpur Center, a medical center, or government's healthcare center in Badshahpur, where we are setting up a 20 to 30 bedded facility right away. In Gurgaon, again, we are also mobilizing self-help groups and equipping them with oxygen tanks, thermometers, oximeters, PPE kits, and also training them on sanitization protocols and all of that. So that's being mobilized at the grassroots level. In Rajasthan, we are setting up 3 COVID care centers immediately in Alwar. We are also going to set up, we are partnering with the government in Rajasthan areas of Savai Madhopur, Dungarpur, Malarna Station, Oda, and Baran. Now, I must emphasize that wherever we partner with the government is coming forward, government is providing human resource where there's available, government is providing medicines and any other infrastructure that is required. So, but we are bringing in knowledge and technical expertise, etc., in some of these government centers. In UP, we are setting up CCCs or community care, COVID care centers in Noida, Lucknow, and Hardoi. In Assam, we're setting up a 200-bedded COVID care center in Khanpura in Kamrup. Now, I must say that you must be surprised or saying that, well, why are we going into rural areas? Because rural areas have not been highlighted as yet as much, right? But these last mile and rural areas and far-flung places like Assam and some other places like Hardoi, they are going to see a surge very soon. We are not taking our eye off of Delhi and Mumbai, for example, where we are partnering with Nanavati Hospital and Max Mumbai, etc. But at the same time, we are planning for other locations where this is going to happen. It's coming. We have data to indicate that that's going to happen. We are working in the tea gardens of Assam, which, where there are 15 hospitals where we are going to set up such centers. And lastly, and I'll stop there for any questions. Lastly, but not the least, we are partnering with Vijay Group of Hospitals in Chennai. So this is some of the work that's been happening in addition to ensuring there is mental health service available through our telemedicine and Sanjeevani clinics and our own digital health and wellness centers as well. So I'll stop there. If you have any questions, please. Go ahead.
Thank you, Roma. Thank you, Roma, for this very comprehensive update, and thank you for all that you're doing. We'll get to follow-up questions in just a second, but Nagma, let me bring you in. Edelgave works with several grassroots partners on the ground, Goonj and Jansahas, who are part of the Chalo Give campaign, being two of them.
Yes.
Can you talk to us about the on-the-ground situation, especially as it relates to the deployment of funds? And secondly, can you also touch upon your perspective on how different or worse is this situation this year compared to last year?
Yes, thank you. Thank you so much for inviting me for such a very relevant conversation. And I'll try to be very crisp about what happened last year and this year and why we are placed to make a comment on it. Edelgave is a grant maker in India, and our strength lies in the grassroots. We are connected. We funded more than 150 grassroots organizations across the country. So the span of our information is fairly wide. Last year, when COVID, the first surge of COVID really happened, we started seeing the incredible resilience of the development sector, where the small, and it was really on the back of the small and medium NGOs that the entire network was mobilized to ensure food security was addressed. And, rations were distributed, and donors were very, very, very generous at that time. So the crisis last year was in 2-3 kinds. One is the migration crisis. 9 million migrants walked back home. That was incredible. It was out there. It was in full public view. And what was not really evident is that while they walked back home, there were hundreds of deaths and there were hundreds of orphans on the highway, and they are even now undocumented. So the violence, the deaths, and the insecurity for children was undocumented, but organizations really rushed to highways to ensure that was addressed. The other thing that happened is the enormous food insecurity that happened, where we just saw starvation. I mean, there was no other way, whether it was in metros or whether it was in rural areas. Wages were stopped. These were daily wage earners. They didn't have savings, and there was no money for the next meal. So it was that urgent. And we saw the way the funders, responded. There was incredible generosity. Just Edelgave alone, within about 3 to 4 weeks, we were able to connect almost 4 million worth of grants to the grassroots, which really work on lean teams. And so that was incredible. Now, in the middle, India actually looked really good. People had started getting back into workforce, but what we saw is out of the 9 million workers, barely 50% went back to work. India has a very rich interstate migration, but right now what we are seeing is interstate migration is almost nil. It's the inter-district migration that is there, because people really want to be able to rush back home in case something happens. So there is an incredible amount of fear that is residing, that in case something happens, I don't want to walk back home. I don't want to be left on the highway again. The second thing that has happened is that women in the informal workforce have dropped by 60%. So there is the repercussions of which, or the long-term implications of this, which we will still see. But out of the 50% that came back, 60% of the women were not there. And they were given very compromised wages. So that's what happened somewhere in the middle. We had a very weaker lower strata of our society. The marginalized society had become much, much weaker. Now, with this surge that has happened right now, a couple of things that we ought to remember. One is that the health crisis is so big and so enormous. And what Roma was saying, there are many such incredible organizations that have been mobilized on the field to ensure there are COVID centers, there are funds pouring in from all across the world, aid coming in for oxygen concentrators, vaccine awareness, vaccine deployment, all of that. And that is needed. Even after all this aid, there is much more that is needed to be done, because India is a vast country and systems across rural and urban segments have collapsed. While the news enables us to cover most of the metros and those places which are well within our vision, the rural distress is almost invisible. Roma was right about that. That's one part. The second thing, which has not hit us so far, which I suspect will start appearing over the next few weeks or maximum 1 or 2 months, is the incredible amount of food insecurity that is going to hit again, because everybody who was already vulnerable has completely. There is no respite right now, because any meager savings that were even again made have gone. We also have an additional layer of poor now, because the middle class has fallen many grades lower in terms of what they had saved. So we are at least a decade, if not two, back in terms of what families have earned, saved for the next generation. So food security, insecurity is the next big thing, I feel. The mental health is going to be massive, because doctors have been on the go for more than a year. So we will see, doctors and nurses either drop off workforce. Dr. Devi Shetty has been highlighting for the last many weeks that almost 3.5 lakh doctors and nurses won't be there because they've just been on the go for so many. So we have to address that. We have to ensure that the entire country's food relief is going to be managed over the next few months, and mental health, not just for the development, for the medical sector, segment, but also for development sector and many other young people, old people, is going to be addressed. So I will summarize by this. We are again, as Edelgi, finding ourselves in that unique position where grassroots have been calling out for help. Funders across the board and so kindly through Indiaspora platform also have been generous and are looking to seek guidance on where to give. Right now, there is a problem of plenty. There are just many causes. I think what hurts people most or compels them is the cause they have to pick, because honestly, everything right now is looking as urgent and important. And I will just pause here and take your questions later if you want.
Wow. Thanks, Nagma. Some of the numbers are staggering. Thanks for the update. Nishant, let me turn to you. We have been reading several media reports, AIF emails, etc., highlighting that AIF has had a lot of success raising funds for the COVID relief work. So first, congrats to you and your team for all of that. Can you just give us an overall update on AIF's focus, fundraising efforts for oxygen concentrators, and any deployment-related updates that you can share with us?
Absolutely, Ashish. First of all, thank you, Sri and Indiaspora team, for organizing this show on this, very important and timely topic, and for inviting me. For those of you who may not know more about AIF, AIF was set up in the aftermath of a large earthquake in Gujarat 20 years back. So our humanitarian mandate is very, very strong. We have responded to all humanitarian disasters in the last 20 years in India. So COVID was no different. When COVID happened last year, we mobilized all our resources to launch a large-scale countrywide response serving more than 500,000 people across 18 states of India. And of course, we were slowly kind of transitioning into a more rehabilitation phase without, of course, realizing that there will be a second wave and it will be so ferocious. So when cases started rising in March, and as Nagma said, I was actually in India in December and January, and unfortunately ended up catching COVID myself and getting hospitalized and things like that. But things were looking pretty normal. I mean, the usual traffic jams on the road, the usual crowds in the shopping malls. And I was going from New York with all my discipline on mask, wearing mask and maintaining social distancing. And it was like a big culture shock for me. So probably I got carried away too and ended up catching COVID. So when cases kind of started rising in March, we started kind of, positioning ourselves towards, what we now call as COVID relief phase 2. Of course, we never called our COVID relief program last year phase 1 because we thought there will be no phase 2, but here we are. And, our strategy is very simple. It seeks to achieve a balance between mitigation, which is about serving the immediate needs of people who are already critically ill and people who are going to get critically ill over the next few weeks. That strategy is mostly about strengthening the health system infrastructure at the frontline level. And there are some things which I'm sure your viewers have already heard about, oxygen, of course, supplies, beds, availability of beds and other stuff. So, and then the second part of our strategy is looking kind of a little bit ahead and looking at prevention and preparedness, which to a large extent is about vaccination, which is also, we are not hearing a lot about it, but that is really probably, in my opinion, a bigger issue in India right now, if you look at the data and where it is headed. So just to kind of give you a sense of what we have done so far, again, I think everybody has said we are very grateful for the generosity of our supporters and donors. We have so far received commitments of over $23 million, which we are very quickly deploying for life-saving interventions through our large team of 900 people on the ground and hundreds of partners, including state governments. So far, we have placed orders for 8,500 oxygen concentrators. 1,000 of these oxygen concentrators will reach India next week. We are sourcing from both the US and the Chinese kind of supply chains. So we can increase this number to about 10,000 in the next couple of weeks. We have commissioned 2,500 additional beds through a model called portable hospitals. These are extensions of existing government hospitals, anywhere between 20 to 100 beds, equipped with 5 ventilators and 10 oxygen concentrators. This is across about 35 to 40 hospitals in these many cities. We have also commissioned 10 PSA-based oxygen generation plants in 10 cities of India. We are in the process of airlifting about 30,000 single-use disposable ventilators, which run without electricity. So these are especially applicable and useful for rural areas in India where electricity is unreliable. And we are in discussions with the government of Maharashtra to help them import 2 or possibly more cryogenic tankers for liquid oxygen plants from China. So a large amount of work is underway. Obviously, the need is much greater. And obviously, we continue to seek funding for all the work that requires to be done. The second part of our strategy is vaccination, and as we all know, India has opened universal vaccination. Anyone above the age of 18 is eligible for vaccination. But we also know that when India started its vaccination program, the target was 3 million doses per day, at which rate it will take 2 years for India to vaccinate all its adult population. This target was set before the second wave hit us, and so probably you can argue that 2 years is something that India can afford to take, but not in the last few weeks. We have seen very high levels of mortality rate, and we just have to make sure that India is able to ramp up its vaccination drive to probably at least 7 to 8 million doses per day. And we are trying to figure out what is the role that the IF can play on both the demand side and on the supply side. We are very happy, of course, to see the global response, the response of the global community. India obviously needs global support. The US government is mobilizing resources to support India, to send humanitarian aid to India. In my opinion, I think US government and many other governments around the world kind of woke up a little bit late, at least 10 days late, if not more. But at least now the things are moving in. India has a very important and large role to play in the global economy. So what is happening in India is not just a health crisis affecting Indians in India. It's actually a global, it has global implications in terms of global growth. Last year, the socio-economic and some of that Nagma was talking about implications of COVID and the public policy response to COVID. So, this is going to, what is happening right now is obviously a very serious issue from a health perspective, but it's going to have a huge, and in many sense, implications which we have not seen before. And some of it we are already starting to see. So it is in the interest of the global community to support India at this time. And, it's the role of organizations like AIF and Indiaspora to make sure that the strategic partnerships that US and India share is really capitalized and leveraged at this time of urgent need.
Well said, Nishant. Couldn't agree with you more. And thank you as well to Roma and Nagma for providing such a comprehensive update. And the work you're doing is really tremendous. One follow-up question I have to the entire panel is, so what is the biggest, if you had to name one obstacle that you are facing that you would like to overcome, what is that obstacle? Is it availability of supplies and equipment? Is it the ability to move logistics on the ground? What is it that you are facing that you would really like to resolve? And we can go in the order that the panelists started. So maybe Roma, if you want to go first.
We are facing is availability of medical equipment. The second challenge is, of course, supply chain management, logistics on the ground. However, we are working very diligently to resolve these issues as well. Having said that, we all know over here how the prices of every item has gone up like 4 times to 10 times, right? Which means that we need to raise even more funds to be able to provide the services that are required on the ground. So having said that, there are medical equipment, if you would give me a moment to say, major items that we require right now are, for example, COVID care beds. And I'm spelling this out just because if anybody wants to donate X number of beds, they will be able to, or X number of ventilators, that they can do that as well. Ventilators, the CPAP machine, a B-type oxygen cylinder, D-type oxygen humidifiers, laptops. I mean, each of our staff members in each of these COVID care centers will need laptops and tablets. So there are 150 laptops that are required and 300 tablets that are required. Now, rest I will, limit my time to say that we do need thermal scanners and sanitizing bottles and anything else, oxygen concentrators, for example. The items that you have been hearing and on social media, etc., that are required are also required by us. So anybody who can help in terms of connecting us with direct manufacturers so that we can procure these devices, or with logistics, etc., on the ground, all of that will be very welcome. Thank you.
Thanks, Roma. Nagma, if we can move to you.
Yes, thank you. So the biggest hurdle I see is that just like last year, visuals of migrants were there and they could communicate directly to anybody who was watching, and there was a reaction to it. Once those visuals have gone, we tend, and there is a fatigue really. The year has been incredibly tough. Then there is in that sense of memory fade of sorts. Right now, the health crisis is overwhelming. There are 2 things that I find as hurdles. One is that we have to remember that whatever is happening is going to have long-term implications on health of people as well as on, their ability, their socio-economic, power as well. So my biggest hurdle is how to get across to people that there is a huge amount of rural distress and food and income security distress that is unseen right now, and may not be seen in this graphic way, but that really needs the global attention, that needs people to give, with patience. It may not be out there on our TV sets, but it is a real compelling need right now in India. So I would like to place that here really, that there is a lot of that kind of distress that is going on. Somebody just asked, I think it was Hetal Gandhi, who said, how do we know that it's going to the right cause? And that is why there is an Indiaspora. That's why there's a Needle Give. That's why there's a Wish. You can check us out. But more importantly, there has to be some place to trust and then give wherever you have to give, because the need right now is overwhelming. And we will have to also plan a little bit about our short-term, long-term gives, just so that we make sure that that we also are able to sustain alongside the causes that are going to keep cropping. This is not going to end in the next 2-3 months. This is a longer term, and we need the generosity to keep coming as much as the problems will keep coming for some time now till we get a full grip on it. That's it.
True. Thanks, Nagma. Nishan, your obstacle?
Yeah, I think Roma and Nagma have already spelled it out. I have had the opportunity to lead large emergency response programs in various parts of the world. But COVID is kind of different, including earthquakes and tsunami and flash floods and things like that, and wars in Gaza, a couple of wars. But COVID is different in two ways, which presents a lot of challenges for to all humanitarian actors. One is that unlike an earthquake, which happens for a few seconds, or a flash flood that happens for, half an hour or 45 minutes, or a tsunami that happens over, let's say, a couple of hours, and it goes, and it causes a lot of loss and destruction and loss of life and property. But then it goes, and then you can mobilize supply chains, you can mobilize resources. It's very localized in nature, so you can fly people in and things like that, and you can kind of launch reconstruction. In case of COVID, it has affected the entire country. So literally there is no one who is not affected. And then there are, very strong, very unique, unprecedented navigational challenges, restrictions on movement. You cannot transport stuff. There are all kinds of requirements in terms of testing, infection testing and things like that before you move people. So there is infection risk everywhere, and how do you kind of mobilize resources and your supply chains is a big challenge. The other big challenge in which it is kind of different is that there is no end date. We don't know how long it's going to last. Is it going to last, the second wave, so-called second wave? Is it going to last for 2 weeks, 3 weeks, 3 months, 6 months? We don't know. Nobody knew that there will be a second wave. We don't know whether there will be a third wave or a fourth wave. I mean, people are talking about a third wave already, right? So how do you plan your humanitarian response in a way that it is tackling not just what is happening right now, but also what might happen in 6 months' time? And I think it's a strategic choice that you have to make, and it makes it challenging. And that's also kind of I think the challenge for all players, not just humanitarian actors, but for corporates, for the governments, government of India, state governments, and for global governments on how to support these things. So these are some of the challenges, I think, at a more macro level, I think this particular crisis presents. And then I want to just add a couple of things here, which is very important. I think while it is very important to focus on what is happening right now, and we are doing it in a big way, as I've already spelled it out, but I think it is important to focus on vaccination. Vaccination, we know, is the best bet we have. We also know from the global evidence and from evidence in India that vaccination is saving lives. But if you look at the numbers in India, unfortunately, the numbers are dipping. If you just look at the last 2-3 days, the last 7-day mean is around 1.7 million doses, which is less than the target that India has set. So how do we make sure that vaccination really happens? And people who typically, some of the people that Nagma was talking about, persons with disabilities, elderly women, daily wage workers, who typically get excluded from such drives, are included here. I mean, street vendors are a good example. They rely on daily wage workers. If you have to let go of 4 or 5 hours of your work because you have to go to a hospital and queue up to get a vaccination, you kind of try to, say, okay, I'll get it done tomorrow. And I think we need to make sure that there are some incentives, some nudge, some enabling mechanisms to get these people vaccinated as soon as possible.
Thanks, Nishant. You, Nagma, and Roma have all made some really excellent points and a very thought-provoking conversation. I wish we had more time to continue this. But we do have another panel to bring in another perspective. But before we do that, Sri, I'd like to turn it over to you. Any thoughts, comments on the excellent panel you just had?
I just want to say thank you to our panelists. They were fantastic. We all learned so much. And getting this information about what's happening on the ground is so important, I think, for the journalists watching, as well as just everyday people who are so moved by the pictures they see on TV, translating the efforts that people are putting in to what's happening on the ground is so important. So thank you very much. And there are comments coming in, and we are very grateful. And Jeanette says, thanks to you all for helping address critical needs in India to save lives. Folks, you can keep sharing your comments and thoughts. We'll try to come to as many as possible, and do what Karen's doing, tagging friends who can watch live or later. We're live on Facebook, Twitter, YouTube, and on LinkedIn. So thank you very much. And now, Sanjeev, you can set up our next discussion.
Yes, that's right, Shri. The one thing I will mention just before I set up the next discussion is we were supposed to have with us Dr. Ajay Nair from India, the CEO of the Swasth Foundation, as your viewers will see at the bottom right of this graphic that's just been put up. And Swasth and Ajay are doing outstanding work. We've been talking to them very regularly. Unfortunately, Ajay did tell me that he and his team for the past 5 weeks have been sleeping probably 2-3 hours a night, literally on a daily basis. And I'm sure that is true of all of our panelists that were just here with us as well. But it could be that, it's early morning in India and maybe Ajay couldn't quite make it because of the time. But, at a later date, we'd love to bring Ajay to your viewership. But with that, let's move to the next panel, which is another fantastic lineup that we've got. This is a donor perspective from here in the United States. And we have 3 donors with us who are all supporters of Indiaspora, and we're all grateful for that, certainly. But more importantly, at a time like this, they are philanthropists. They are people who stand up to be counted in the hour of need. And that's why we really value them in what they do. So I'd like to welcome Narendra Mulani, who's an entrepreneur and an investor. Asava, who is the co-founder of Hunger Mitao, and Raju Reddy, who is the founder of Kakatiya Sandbox and a supporter in the Bay Area of the Sewa organization. So welcome, Raju, Narendra, and Anna. Great to have you on the show.
Thank you,
Anna,
Sanjeev.
Thank you, sir.
Hi, Anna, you're joining us from Dallas, right?
I am.
Great. And Narendra, you are in...
I'm in Connecticut.
Fantastic. And Raju is joining us from the Bay Area, right?
Yes, Sanjeev. Yes.
Great, good.
I was in India just last month, but yeah.
Okay. Well, great to have you back. I guess you came back before the COVID infections really had a big spike in India.
Yeah, just about. Yeah.
Right. Well, great to have all 3 of you. So I'd like to start by asking the first question to Narendra Mulani. Narendra, you have been a supporter of the COVID relief programs that Indiaspora has had last year and this year in a big way, and we really appreciate that. But what I really want to ask you about is you have a very sort of a deep and a broad perspective on what's going on in India, because I know that in addition to supporting the efforts of the downstream partners of Chalo Give, you've been very involved in coordinating oxygen supplies and shipments and so on and so forth. So give us your perspective as a donor. How did you choose these specific causes? How did you choose the partners to work with, the organizations to benefit? What are some of the thoughts that go through your mind as a donor when you're selecting all of these?
Yeah. And firstly, thank you, Sanjeev, for inviting me to this conversation, especially with other hosts like Raju and Anna, of course, who I've had the opportunity to really get to know over the last year, her and the wonderful work that she and her husband have pioneered for us. The choices were very clear. I think in both, as the gentleman earlier said, we never thought that we're going to have a first phase and then a second phase, right, of COVID. But in the first phase, as we know, hunger with the migrant crisis in India, as well as the challenges over here in the US, hunger was a prime issue. Just the ability to reach out and make sure that people have essential provisions through the lockdown was a major issue. And so being able to connect in India with those that we were confident could get last mile execution done to ensure that the migrants were being really looked after through this tremendously stressful period was prime on our minds. This time again, I think the whole focus has shifted, but it's in some ways very much the same. The challenge in India continues to be just deeper after at a macro level. After a year, we know that over 100 million people in our country of birth have slipped into poverty. And at the same time, we are facing an unimaginable set of crises, not just one this time, of sickness, of hunger, and of all the different socioeconomic problems that exist today and will exist for a while, as Nagma Mullah pointed out earlier. And so the choices to me, and I think to many of us, were very clear. Again, Indiaspora gave us the ability to be able to work and connect directly with those that we know could affect and execute on the ground today, right? Whether it was the Wish Foundation with what Roma laid out very clearly, or whether it's Gunj with their ability to be able to really execute on the last mile with food and different supplies. So to me, I think that was the common factor. And finally, as you mentioned, I've had the privilege of joining a few others in oxygen acquisition and delivery into India, and over there too. I think all of us want confidence that you are investing so that your fellow citizens in India are going to benefit from it immediately. And the group that we invested with, we're very confident of being able to get to the last mile and get the deliveries into the hospitals and the COVID care centers. So there is much to be done yet, right, as we all know, but today it's all about immediate relief, and the ability to channel it through Indiaspora as well as a couple of other organizations has been key.
This is great, Narendra. Thank you. Thank you for your leadership, and thank you for your generosity. Anna, let me ask you a slightly different question. This deadly second wave in India has impacted you personally. Your parents, as we speak, are recovering from COVID. You had mentioned to me yesterday or this morning that there is a sense of desperation and helplessness that drives people to do whatever they can to help, which, for most of us in the US is to give. Can you share more on this and your personal reflection as a donor as you navigate, these times?
I think you'd hear probably the same story from every person of Indian origin who is not in India right now. It is, distance has never felt so far, ever. Of course, I'm not alone in this. I know a lot of families have had, personal impact. Fortunately for me, my parents are doing fine. Thank you. But we did all suffer the nights of frantic calls, the fear, the frantic search for hospital beds, oxygen, for medications. We've had a few deaths in our extended family. And all we can do is sit here and watch and FaceTime and talk. It's ridiculous. I think a lot of us will probably need mental counseling too, because this has been really horrendous to watch. But we can't just sit and watch. There are things we can do. And that's where, I totally agree with Narendra. The community that Indiaspora brought together made it easy for us to engage, because having to figure out, who to give, where will this money go, would be paralyzing right now. So thank you guys at Indiaspora for putting together this very thoughtful framework. And, all we needed to do was write a check, and we are assured that it will go to the right place. That's very helpful. But, my heart goes out to everybody who is impacted in this time. And I agree, this will take time, but we need to stick together.
Anna, you're a modest woman. I know you do a lot more than writing checks. you're very actively engaged in your philanthropic work with Hunger Mitao and so forth. But I'm delighted to know that your parents are doing well now, and you're exactly right. I mean, I don't think there is anyone that we know in the Indian community here in America that doesn't know someone, or actually multiple people, who have been impacted and very, very sadly in some cases have succumbed to COVID, the second wave. So you're exactly right. I want to turn to Raju Reddy. Raju, Ashish and I are partial to Indiaspora, as you might imagine, but I want to turn this conversation a little bit and put a different lens on it. This is about more than Indiaspora. It's about the broader Indian community coming together. And, of course, we love your support of Indiaspora, but you're also a big supporter of the Sewa organization in the Bay Area. You're an advisor to them, you support them, you have been doing for a few years. They have been doing yeoman work as well in this crisis. Tell us a little bit, if you would please, as a donor, Raju, what is it that attracts you to give to Sewa, and how do they utilize the funds that you and others provide them?
Right. So first of all, thank you, Sanjeev, Ashish, Indiaspora, and Sri, for making this forum possible for us to share what each of us are sort of doing whatever little we can to address this, and hopefully get more people to participate. This is clearly, as I think one of the speakers earlier mentioned, by all indications, it is the biggest humanitarian crisis that we've seen in post-independent India, right? And in some ways, it's not just India's crisis. Just the way the pandemic and the virus works and mutates, if you don't address it soon enough in India, this is the kind of thing that could affect all of us here in America directly in more ways than it has already, right? So I think there is a certain amount of, clearly right now we are all very torn by this almost sense of guilt and fear, kind of staying so far away and wanting to do something and not being quite there with our family. Yeah, like I said, I just got back about 3 weeks ago, and like everybody else here, had quite a few people in my family who have been hospitalized, and some unfortunately that couldn't make it in the extended family. But as I over the last 2 or 3 weeks, as this sort of many of the organizations here started looking at ways that they can contribute towards addressing this. I've also been reached by several organizations, and for me, I've actually written checks to at least 3 or 4. And Sewa is the one where I've put most of my time and capital so far in my own little way, and also reached out to more friends to encourage them to contribute to Sewa. And the reason for that is Sewa specializes in disaster relief. I don't know how many people are familiar, but they did extraordinary work right here in California when the California fires happened in Santa Rosa and the Chico area. A lot of these, it's not just capital, but there were over 100 volunteers that would go every weekend to Chico and to Santa Rosa, some of these places, and work with the people there, and also with the Houston floods. So as an organization, I think they are sort of structured to do that, just disaster relief. And also even within US, when COVID hit last year, they had a big program. I think it's about a $15 million worth of goods and services, and they still continue here in US, Sewa International, right? And clearly in India, they have a very large network infrastructure there. So to me, the fact that in some ways I feel like, at least in the Indian American organizations, always felt they were more like the gold standard when it comes to disaster relief. And so it is relatively easy choice. And, last week, I think on April 28th or 29th, they shipped the first set of oxygen concentrators. I think they started actually with a 500,000 campaign that now grew to a 20 million campaign within just about, 1 week. And they partnered with UPS. Thankfully, UPS Foundation, shipped that free to India. And that package, that has a lot of essential kits and oxygen concentrators and ventilators and a whole bunch of medical supplies that went to Delhi, and from there it is going to 6 cities, and from there to another 21 cities across 16 states, I believe. And some of the folks talked about the last mile delivery. I spent a lot of my time in another social impact initiative working with Deshpande Foundation. A lot of that is in rural Telangana. And there's absolutely no question. I mean, while the problems of urban India are very visible to people like you and I and the rest of the folks on this forum who have the resources or some means, the problems in rural India are far more significant. And, they are kind of relatively, untouched by a lot of whatever, growth and prosperity that may happen even in India over the last decade or so. So I think organizations that also have the ability to reach some of the rural areas, that was also an important consideration for me when I decided to, support Sewa. And, at least the other aspect that I just wanted to mention is, thank you to all those wonderful donors and volunteers who have given money, not just to Sewa, but any of the other organizations here and others that I've also supported. But, I'm finding a lot of people in my network who are not Indian Americans, right? And so I think more of them are definitely starting to, feel for this and also recognize that, as it's been often said on, TV by CDC and others, I mean, unless, everyone is safe and vaccinated, we are not safe. So I think there's also that increasing realization that, India is now clearly the epicenter of this crisis. But, it's not just the Indian Americans. And I'm actually very encouraged and particularly thankful to people who may not be from the, Indian background that are making their time and, of course, their donations, to some of these organizations.
Sorry, thank you, Raju. This is great information on Sewa, and thanks again. I want to try to squeeze in 2 follow-up questions, so let's see if we can. So I guess the first one is based on the comment that we saw. When it comes to giving from the US to India, there's always a certain donor hesitancy around the question of, will my money make an impact? And would love for, either or all of you to get your perspective on, in your journey, what are some things that you have done to overcome these obstacles, information gaps, etc.? Maybe Narendra, we can start with you and then go in the same order.
Yeah, sure. First, I just want to pick up on what Raju Reddy said. In this time around, I decided I was reaching out to everybody who I know, my whole contact list, right? Whether it's of Indian origin or fellow workers or board members or ex-partners of mine or friends, family. And I've been delighted, the response, whether it's Americans or Indians or whatever, everybody has responded extremely well to this request for supporting relief efforts in India. And I think that what's made the difference is a couple of things. As everybody knows that what happens in India is very relevant to the world and to the US. But the other part that I think I felt very comfortable reaching out, and I think people felt comfortable engaging, is because we've all been very focused on making sure that this last mile execution, whether it's rural or urban, is a common thread throughout the initiatives that Indiaspora has supported, or Sewa has supported, or many other organizations have supported. And giving that type of focus and confidence, I think has made a tremendous difference. I'll just end by saying my part by saying that this community brings a lot of special people together, and I was really delighted and struck by the amount of outreach that Raj and Anna Asava did in the first go around, and they gave me a lot of confidence, not just to personally give, but to pick up my phone, email everybody, reach out to anybody I knew, and do it really not as an opportunity for me to ask them, but to give them an opportunity to really participate in what has been an extremely important and noble endeavor. So the community does a lot. You learn from each other. And I gained a lot of confidence over this year in being able to reach out and ask others to join us in this very special cause. So, Ashish, that's what I have to say. Yeah.
Great. Thank you. Anna?
I'd only say there are donors who have given a lot, but there are a lot of people who are kind of just testing the waters because they're not sure of, there's so many charities that have sprung up. There is so many asks that are happening, and people are not really certain how this is going to pan out. They want to give, but I think that's where, coming back with some updates, with some relevant stories, because just before the show, I was watching television and they were talking about, all these oxygen machines being stuck in customs for 7 days. And that kind of, it's hard to kind of grapple with. So I think if you can come back to your donor base with stories of, hey, this is how your donation has gotten through the last mile, I think that would be very assuring to a lot of people. And I think for a lot of people, this has been just the tip of the iceberg, as they say, when it comes to their giving. They want to give. They really want to give because they want to be a part of the solution. But I think, a little bit of storytelling needs to happen.
Great.
Yeah.
Raju?
Yeah. So I think, a couple of things. One, I think back to Anna's point, there are a lot of them who have not yet given, and obviously watching this with some amount of pain and sadness and wanting to do something, but I think there is also a sense maybe that, hey, yes, this is very bad, but we'll hit the peak like in another week, another 2 weeks. After that, things will start recovering. So, but as I think some of the speakers here touched upon, even if the first wave put 100 million people into poverty, just imagine the devastating impact this is going to have on so many lives, not just for the next 2 months, 6 months, but next 2 years, 3 years even, right? Or longer. So any money that you give, this is not just, yes, of course, every organization is doing its best to get it as quickly as possible to the person that needs it the most wherever across India. But the money that you give now is extremely important, not just for the next week or two, but for the next 6 months, 1 year, 2 years, all of that. So that's one thing to keep in mind. The other one is, in fairness, many of these people, the volunteers, as good as they are, as good as organizations are, many of them I know within Sewa, they're barely sleeping 2-3 hours a night, even sitting here. They're working, it's almost like their hours are like the doctors at the front line. Now, clearly it's not as stressful, but just in terms of, so in terms of, trying to, I think the larger organizations are able to keep up their information very current and all of that. But, there are others like Oxygen for India that have contributed, or Nirman, a few others. But they may be, a little bit more behind in terms of updating that information. So bear with that also. As long as you have sufficient confidence, like in the case of Sewa, they're a Charity Navigator 4-star rating. There are very few organizations in the world that have that, right? So yeah, but even the smaller ones that have sprung up and, that are trying to help, I think all of them can use our support right now, whichever one you feel most comfortable with, right? But I think the reality is, yeah, it does take time even for them to report all of that. But for most part, I think the more established organizations, I think they're extremely transparent. They're actually showing exactly where your shipment is. I know in case of Sewa, they actually show that if you go to their website, SevaUSA.org, very current information and all of that, right? But even there, it's sometimes 48 hours old information, maybe. It's not 2 or 3 hour old. So,
Right.
so that's something to keep in mind. Yeah.
Yeah.
Thank you, Raju. This is great advice. I want to ask one final question related to the diaspora. I know that as philanthropists, you are very well acquainted with excellent organizations. Can you tell us about your perception on how the diaspora has rallied, for the cause so far, and your initial impressions of how, how easy/hard in terms of fundraising it's going to be, because it feels like this is going to be a long slog, and we are in this for the long haul. So, what are your impressions from engaging with your colleagues, fellow philanthropists, etc.?
Yeah.
I guess I think the diaspora has rallied tremendously, but there's much more opportunity, as Anna pointed out, and that's clear as you speak to many of them, that they're dipping. Many people are dipping their toe in the water for various reasons. One is they want to make sure that they have an impact. And I'm sure some of it has to also do with we've been at this for a year.
Yeah.
This has been wherever you are in the world, whether you're on the giving end, the receiving end, the lucky end, this has been a tremendously emotionally wrenching year, and there's more to come. Right, 100 million people is 7% of India. Just do the math. And so we're in for a long journey. I think this is a very good question, Ashish. I think we have to think of some of the principles that we're talking about here. Make sure that people understand that their donations and their time is having an impact. Measure the impact. Play it back to them. Make sure that because every dollar counts. But at the same time, every dollar has to be shown that it is, it's worthwhile the journey, because it doesn't take a lot, but it still does require constant support. It's going to be many years before India even comes close to recovering from what we went through. So that's kind of what my thoughts are right now.
Yeah. I totally agree, Narendra. I would also add that it has been a very difficult year and a half, and people in the US also, there's a lot of people who are actually concerned for their financial stability.
Right.
And we saw last year that what started in one remote area spread throughout the world. So there's actually viable concern that this second wave or third wave, this nasty wave, is going to come back to us, right? So people are concerned. What happens then? Who's going to help them? So I'm afraid donor fatigue or donor concern will set in. So we do have to kind of look at how do we tackle this together. And as immigrants, we've got two responsibilities, right, to our Karma Bhumi and Janma Bhumi. How do we balance that? Because I believe that on both sides, it's going to be a long haul.
Yeah. So I'm, as staggering this crisis has been, and will probably continue to unfold like that over the next few weeks. In some ways, I'm actually optimistic that this is the first time the Indian American community has come together in ways that completely unimaginable. Right from people in the White House to Congress to the CEOs of companies and all the nonprofits that we're seeing. And I think some of the attention and the relationships and the networks. Indiaspora was trying to do that, right, as an organization to bring the Indian American community, to bring the focus onto issues that matter to this community. So so much of the people that are not of Indian origin, that are also, I think, paying such serious attention to India, and even within India, I think there is a little bit more of an awareness. I see that. I spend a lot of time with the tech entrepreneurs, mostly, that are building products for a global market. A lot of the young entrepreneurs. I mean, these people are building some fantastic companies that will become global brands. Some of them are in the process, right? But many of them are also asking this question: hey, how could we get here? I mean, what can we do in the future? Because we just didn't have the right infrastructure to react to this thing, right? To prevent this sort of thing, not to react, sorry. We're able to react to these things like this, and hopefully we'll get through, with harm, but not that much more harm. But I think a lot of these people are coming to, there was an initiative called ACT, Action for COVID, in India, that brought the top entrepreneurs and the VCs to put together in the first wave itself, right? They brought together about 100 crores initiative, first time. These are not people that got together, and these are some of the best problem solvers in a way, the entrepreneurs in general, right? So if those minds are able to start, devote their time and attention to these sort of general social issues, that, and that's the opportunity that I see coming out of this. As sad as, as challenging as the next, few months are going to be. So.
Raju, Anna, Narendra, thank you so much for your perspective. It's been incredibly valuable. I believe that what you've shared here today will actually encourage many other donors to follow in your footsteps and give more and give big now, because now is the hour of need. And thank you for your leadership and your, your generosity, as Ashish was saying earlier. Sri, I'd like to bring you in. Any thoughts, comments?
Sure. Satya says, so grateful there's an Indian woman speaking here. We all had other Indian women speaking as well. And just so grateful to our panelists for sharing their thoughts. I know that everyone here has learned so much, and people watching on scroll.in and on the Indiaspora channels. Everybody, please share this right now. Your friends can watch as soon as we leave. This will be back on the air and running again. So tag a friend who would benefit from learning from this. Last question to Ashish here. I'll just ask, remind us how people can support Chalo Give and Indiaspora in its work.
Yeah, as for this COVID crisis, we launched Chalo Give last week. As I said, go to www.chalogive.org. And, we have 3 areas that you can give to. You can give to health, you can give to livelihoods, and you can give to direct cash transfer. Pick what resonates and give as generously as you can. Shri, in closing, I'm just going to repeat that, there is hardly, like I said, there's hardly anyone who is not touched by the second wave. We've heard from donors, we've heard from on-the-ground organizations, and the one common area we can all pitch in is by giving. So, we are talking about all organizations, so whether it is AIF, or whether you want to give to Sewa, or whether you want to give to Chalo Give, like I just said, please give and give generously. Time is of the essence, and every dollar that you can give can help save lives and support livelihoods.
Thank you very much, Ashish. And thank you to everybody on the team here. We really appreciate your time today. And we'll see you again for another episode of the Indiaspora Community Conversations. Thanks very much, everybody. Goodbye.
Thank you.